Welcome and congrats! You have found the MMAC Minute podcast, where Shar, RN and owner, and Mallory, NP and Medical Director of Montana Medical Aesthetics Clinic, hence the MMAC, take a little dive into the world of aesthetics. Join us as we discuss hot topics and timeless truths. We will be your guides to navigating your own aesthetic journey. Hello everyone, welcome to the MMAC Minute podcast. We have a very special guest today. This is Jaimie, round of applause. She's a nurse practitioner new to our practice, and so we wanted to introduce her to you all and let her tell you a little bit about herself. So, as a quick reminder, before you do anything else, Shar can't keep her mouth shut.
I was gonna say, we have to say the thing.
She's been told that she asks too many questions back to back and doesn't let us answer them. So we're basically putting a muzzle on her today. And she said, no, I can do it, but clearly she can't.
I don't think I can.
Anyway, so we want to ask a huge favor, but it's not that hard. All you have to do is like the video, follow us, and subscribe your notifications so that you will not miss an episode, because you do not want to miss an episode. Okay, now back to Jaimie. Welcome, Jaimie. We are so glad to have you here.
Thank you. I'm happy to be here.
All right, so tell us a little bit about yourself, where you've worked before, your work experience, and what brought you into aesthetics, and just like a little bit about Jaimie.
Well, I started in the Navy, working on airplanes. I got out and decided I wanted to be a nurse. I worked in the ER, surgery, home health, travel nursing, became a nurse practitioner, got certified with the National Laser Hair Institute, and I worked at St. Vincent here in the OR. I've also worked at the Yellowstone Plastic Surgery office, and now I'm here.
So she knows a couple of things.
Probably one or two.
Probably a couple of things.
One or two.
So what is one of your favorite aesthetic procedures to do?
For me to get or to provide?
Both. That's a great clarifying question. Now you just buy yourself an extra one to answer.
I like getting neuromodulators for my TMD,
And tell everybody what TMD
is temporal mandibular disorder. But being in aesthetics, I found out that you can actually make it worse with Botox versus actually having it treated by an oral surgeon. And then I love lasers. So
lasers are fun. What's your favorite kind of laser treatment to do or to get done?
Or that you think makes one of the biggest impacts on skin?
See, she can't.
No.
Well, I have a couple of teenagers that I've really kind of been trying to advocate for lasers for acne.
There you go.
So I think it's fun to help people with their acne.
I love that. Also, we talked about we're going to have to try out the Clear Lift, because we've talked about melasma, and it is just so great for that. So you're going to love that one. Okay, Shar, here you go.
So
she's been waiting.
Now you just put me on the spot. That's not fair.
Oh.
What do you tell us what you like to do in your free time?
My ultimate dream would be just to feed cows all day long. I have a little farm with 2 donkeys, a horse, 9 chickens, 2 dogs, 4 cats, a husband, and 2 kids.
Let's save the best for last.
No cows yet.
No cows.
Yes. There's still time. You can fix that.
But
you get those little minis.
I really enjoy my animals.
No ducks either, but
Chicken
don't worry.
TV is pretty fun.
So is duck TV.
Yeah.
So what days are you working here?
I'm working Monday through Thursday. The late days are Thursdays, so everybody can come in after work.
There you go. All right. Charlotte, what other questions do you want to ask?
So tell us kind of when you said you went to the Laser Hair Institute, what does that mean? I mean, if somebody doesn't know what that is, what does that mean?
So the Laser Hair Institute, they first started off just focusing on laser treatments for aesthetics. but they did expand from lasers to treat, doing BBL, IPLs, profractional lasers, contouring. They implemented also injectables and fillers and microneedling and PRP.
I didn't even know that.
So really comprehensive.
Yeah.
It's really a large array of classes that they provide.
Awesome.
Wow. So you've been here for now, this is the end of your 4th week.
Yes.
Okay. And
Already?
I know, right? Isn't that crazy?
Yeah.
So we've been trying to bring Jaimie in with us with treatments, and make sure that she gets introduced to people, because when if somebody calls for an appointment and Mallory and I are maybe don't have an available spot, we can say, well, Jaimie has something, and it's like, well, who's Jaimie? And so we wanted to introduce Jaimie and make sure that people know that she's a face and a name around here, and that she is very qualified, and she's treated me, and she's treated several people already,
And me.
And I keep touching my throat because
I know. I was trying to look and see if you could see anything.
I don't think you
but
can.
Wait, we'll get to that.
Yeah. Okay.
All right. So then, that's a good segment. Anything else that you would like us to know about you, Jaimie, or everybody out there to know about you?
No, I'm just happy to start this part of my life and make new friends and
Check.
have fun.
Get to know everybody. Well, and
We're
one
glad to have
thing, she has said to me, and she's probably said the same thing to Mallory, but she just has repeatedly said, you guys have the best clients, you have the best patients that come here, and just every day she's just like, you guys, you just have the nicest and the best and the most realistic people, and they are just so real and kind, and we're like, well, I know we do.
Can I tell you what I thought you were going to say when you said clients? I thought you were going to say clinic, and I was like, wow, humble brag. Way to throw that in there.
We do that too.
It's so fun to work here.
But anyway, and so that's all thanks to you guys, and we so appreciate it and love it.
We do. It makes it fun.
So and so she has made some threats that she might want to take some of my people.
You can do it. We share.
Right, we do. There's no my people, your people, so we do share. But so it's been really fun, and it's been fun. We know we always have the best people, but it's really fun to hear from somebody new to us that we confirm exactly what we already do.
You guys are pretty special. We love you.
So we know you'll welcome Jaimie as we've welcomed Jaimie, and so So anyway.
I look forward to meeting all of you.
Perfect. All right, well then, I guess that takes us to our next segment where we talk about this week's obsessions. So I'm gonna go first and let Jaimie see how we do this, because we did not give her notice that she was gonna be on a podcast before today. So my obsession of the week for work is I'm doubling down on the hyflicator. I love it so much. So Shar and I both got little treatments done by Jaimie over here. I'm gonna get in here and see if you can see. So you probably can't see that much from far away, but these little spots here, and I have a couple teeny tiny little scabs. So we went to town with the hyflicator and zapped a couple of things. And honestly, it was just like not painful. It's so easy. There's not really downtime. Went right back to work after and totally forgot about it. I said, I didn't even mention it to people, and nobody said anything to me. So very easy way to treat lots of little skin things. So if you have questions about whether the hyflicator could work for something, it works really well for like these little sebaceous hyperplasias that we get. They look like kind of like irritated pores that kind of, you think there is it a little bit, but they're not really, and they kind of keep coming back, and they're kind of hard to get rid of. They work really great for that. So we got a couple of spots on me here. And that's what we did to Char's neck over there. So that's why. I mean, it's not really like leprosy.
Oh yeah, look.
But yeah, you can see it now. Yep. So anyway.
So because I make, I make skin tags and seborrheic keratoses and other various things. Like, if I could get paid for them, I wouldn't work as much.
Yeah.
I just make them with gusto. So they really had a heyday on me. And again, there were some spots, neck is a little more tender, there were some spots a little
I think you could feel
spicy,
it.
but at no time did I want to stop.
And no numbing required.
No numbing. It didn't hurt. I mean, afterwards, when it was done, it was done. It didn't itch. It didn't, nothing. So that was Monday. I had that done. last night when I went to bed, I was just like right here for some reason, just was a little irritated. Not slightly like a
You could
little
feel it.
tiny bit itchy maybe, but not even bad enough that I put anything on it or anything. But I could have put some BioCool on, which is a cream that we have that has a little bit of lidocaine, zinc, aloe vera, and vitamin C in it, and that usually calms this down. It calms anything like that down. Like if I use Retin-A on my neck and it gets really inflamed, I'll use that and it just calms it right down. Mosquito bite, bee sting, anything. So I could have used that a little bit, but really, I can't wait for all of those things to be gone. But when you talk about hypercator and stuff, we talk about lasers, and people really know, kind of have a more familiarity with lasers. So how would you describe
we talked
what the
little bit about the hypercator
hypercator
before, but it's electric cautery. So it's just like, if you think about cauterizing a little blood vessel or something, like Jaimie said, we do that in surgery. If there's a vessel that's bleeding, you could just put a little bit of electric cautery there, and it kind of like seals off the vessel so you don't have a lot of bleeding. So it's really cool for taking care of little skin lesions and things.
And it does little vessels. She did a couple of my little nose veins. I had a little bit larger cherry angioma on my back, and they got that.
Yep.
So there are a lot of things that can be treated, and things that we can use lasers on some of those things, but some of like the seborrheic hyperplasia and stuff is better treated with the hypercator, with the cautery. So it's just something new.
Charlotte Diane has also been told that she is long-winded. So I'm gonna cut her off here and go to my
listen.
No more. You're done.
You're
done. Okay, take away your mic, Jaimie. Jaimie, your
did
first mission is to take away her mic.
I don't want to get fired yet.
3-minute
Ah,
Instagram
someone
story
can edit.
yesterday, or
We can edit this
video
out.
yesterday,
We'll
and
just cut
it
her
was
out.
so
It's fine.
difficult.
Just cut her out. Okay. Anyway, my personal obsession. I'm gonna project into the future because I'm getting more ducklings very soon, and I am so excited about that. It's kind of almost all I can think about. So I'm really excited to get new little baby ducklings, and I will share some with you guys, some little videos. You can't not. All right, I'm done now. Char.
So I'm just going to say that I learned a lot about different cleansers and ingredients in cleansers, and that was kind of fun. I always thought cleansers, that was was a video I did yesterday, and it was really interesting to learn cleansers. Just one cleanser is not another cleanser. It's just, there really are specific reasons that you would want to use specific cleansers with different reasons. So that was with different ingredients. So that was really fun for me to learn. And then my personal is I'm going to go on vacation in early April for a week and go to California, the Northern California coast. So that'll be fun.
Fun. Okay, Jaimie, now you know how this segment goes. Tell us your obsession of the week, either one first, work and then a personal one.
I think my obsession for the week is utilizing the Jan Marini skincare line. I'm kind of really bad at sticking to any kind of skincare
You used to
treatment.
be.
But I'm gonna do like a whole video thing, a before and after, and my son's gonna help me edit it because I am not tech savvy at all.
Well played, Mom.
But my personal obsession is my little farm and family.
Aw, I like it.
My chickens are the funniest.
Birds are the best. They just, I could watch them all day. Yeah.
That's perfect.
Gotta get you some birds, I guess, Char.
You can come watch
I
mine.
had cockatiels when my kids were little.
No,
I've done the birds.
same.
That's not the same. We'll figure it out. Don't worry. Leave a comment below to tell us what kind of bird Char should get, how many, and what she should name them. Yep. I'm open to that. I think that'll be a really fun discussion. And then we'll vote on it and then make her buy them. So, just kidding.
We'll
All
bring
right.
it to the office.
Ooh.
It'll be the office pet.
I love my ducks, but I definitely don't want them inside. We did that. I'm done with them inside. So that's your project, I guess, Jaimie. All right, everybody. Well, thank you for tuning in. We appreciate all of you, and we are very excited for you to love Jaimie as much as we do.
Welcome.
Bye, guys.
Bye-bye.
Hey, we wanted to come on here right at the end to clarify a little something. earlier in the video, you heard Jaimie reference that maybe putting neurotoxin into and treating her TMD would make neurotoxin to that area might impact it in a negative way, might make that worse. There's a difference between treating TMD, where it's the joint, the disease caused by the joint, kind of up here, and treating the masseter muscle, which is down here. So the masseter muscle, we still treat. We just leave this treatment for the joint to oral surgery. So Jaimie, why would we treat the masseter muscle?
For pain relief, masseter muscle is very strong, and it can cause grinding, clenching. It can cause
Ear
tension,
pain.
headaches in the back, ear pain, migraines. So by paralyzing that muscle and kind of causing atrophy, decreases the pain, and it's kind of hard to find an oral surgeon at this time in our area that will treat the joints.
But we don't want to confuse people. We treat the muscle, not the TMJ or the joint. All right, we just wanted to clarify that, and so people weren't confused, because we thought we were a little confusing. And we're probably more confusing now, but anyway.
Yep. See you soon.